Jack, when I was in school, I had a professor who used to say the worst thing a therapist could do was to validate an irrational belief or something that wasn't true to a patient or a client or a loved one. What do you say to that? How does that play out?
I say that's good advice. I think feeding into somebody's delusion isn't helping them, and as a clinician, we're supposed to not do anybody harm. Like, that's the ethical rule, right? And so I think that if you give in to somebody's delusion, that's not doing them good. It actually is doing them harm, because in the long run, it's not going to go well for them.
Delusion is a good word, but I want to soften that word, because I've heard people tell me that they do certain things because of their upbringing. And I could validate that and say, you know what, you had a rough upbringing, and so it's okay that you do that. But I feel like that's just a terrible underestimation of what a person's capable of. And I feel like that's a terrible underestimation of what a person's capable of overcoming.
Yeah, I mean, we should give ourselves permission to be human, to make mistakes. But if you're living out something that you know isn't good for you, you know that's wrong, or you know that's inappropriate, it's not good. You shouldn't be seeking validation for that. You should be seeking somebody to give you maybe another way, an alternative path, and then you can wrestle with those things and pick the way you choose. But just to feed into something, I'm not going to help somebody feed into something that I can see is going to cause them harm.
This won't be popular, but I don't think that many people are going to see it. The way that modern psychology is going is it is going towards the direction of what feels good, necessarily of what is better. So I talk to people who come into my office and say, you know what, I don't like what you're saying to me. You just don't understand my situation. What you're saying to me when you say that is that I can't overcome this situation. Now, it is incumbent upon a therapist to recognize that you're going through an experience and that you're in it. But it is a disservice for me to look at somebody who's telling me that they have to suffer, and this is how they're going to be sick, and this is how they're going to get better. Obviously what they're doing isn't working. So we don't want to look at a person and say, your situation can't get any better because things just are what they are. You can always change your situation.
Yeah, there's ways to find coping skills that are healthy and appropriate for your life, that's conducive to having a good future and being successful and happy and having purpose. But if we're handling things in ways that are harmful to us, that aren't helping us, and all we're trying to do is seek somebody to validate that, it's not a good thing. And as counselors, if we do that, I do believe that we would be doing that client harm.
If you lead counseling every single session and you feel wonderful, that may be a good thing, and maybe that's what you're looking for. But I would suggest that change is uncomfortable, and it doesn't always leave you feeling good. I tell people sometimes, if they're thinking about leaving because they're mad, to sleep on it. And maybe if you feel that way, then maybe you're probably right. But if you sleep on it and you realize that maybe I'm unhappy because what I'm being challenged to do is going to upset what I've always known, well, you might wait and see if it could lead to something different. Do the same thing all the time, get the same result. Do something a little different, you might change your life.
Yeah, I think this culture has become quite self-absorbed, and a lot of it is about us, me, and that's just not a good place to be. And if we look at life that way, we're going to be able to take on these bad habits, and it's going to be okay because it's all about me. And I just think that's a bad way to do it. And so when as counselors, we have to make sure that we help people to get out of that mindset, that there's a big, awesome world out there. It's not all about you. If you make it all about you, it's going to be really hard to be successful and have good relationships and make an imprint in this world.
If you maybe you need to talk to a counselor about some of your beliefs to see if they are rational or irrational. Maybe you need somebody who'd be willing to look at you and care enough about you to say, hey, that's not reality, or maybe it is reality, but it doesn't have to be. Well, Jack does that. Jack will tell you. And well, we do counseling, and the goal of counseling is to help your life to improve. And if we can help, give us a call.